So the Chronic Care Workforce Initiative 2018 came about following the initial Chronic Care Workforce Initiative in 2016 and 17 by the Central Hume Primary Care Partnership led by Leanne Cleland, which looked at a training needs assessment which identified gaps in the knowledge of health professionals in self-management support, and then provided some training for a number of health professionals to complete training within self-management.
So I found the training was very valuable. It was easy to digest, there was lots of videos and case studies, and I found it, out of all the other online trainings that I've done, it was very useful to be able to come back to it. So you could do a section and then save it and then come back to it later, and even just the availability to be able to do it on a computer at home as well. It's important for health professionals to realise that patients do want to take care of themselves and they want to self-manage, but if they don't have the skills or resources to do that, it makes it quite difficult. But through this course, clinicians are able to have a variety of tools, because it's not a one-size-fits-all, and people will need help in various areas, and at the end of the day they aren't health professionals, but they are professionals in themselves. They know how they're feeling, they know what's going to work for them, what's going to work in their lifestyle and their different environments, and if we can assist them in how to actually manage their chronic conditions and live a higher quality of life, that's very important, and then they actually feel empowered and they can walk away with something and feel like they have control over their medical condition. It can be really important for the patient to take that ownership. So I think this project is very important, to have those partnerships throughout various health services and linking in and sharing resources, because especially in small or medium-sized rural communities, we don't all have money for this and money for that and money for other training. We need to be supporting each other, and if you don't know training's out there, then you don't know when you don't have access to it. So building those partnerships and having the PCPs at the core of that, and making sure that all the resources are available to clinicians and that they can have access to various things is quite important.
So the PCPs played a central role in collaborating and promoting the project within each of the 4 PCP catchment areas, so working with member agencies to help recruit health professionals to participate in the training, promoting the training and supporting the work of the project.